Welcome everybody to get a picture of some of the up and coming new exciting news we have to share relating to EMSCULPT NEO, which has already been tried and true in the body market. And we're just taking it to the absolute next level. And we have a group of experts here that together we are going to share amazing data, amazing stories. We're going to have a real conversation about what is my passion. My name is Dr. JD McCoy, and I am so happy that we are really focusing on functional wellness. Hallelujah. Because I will tell you, and we have got a panel here that all of us are very passionate about functional medicine, but we are talking about this transformation in not just what we are passionate about, but what patients are demanding and wanting, and being able to fulfill a need that is on the exponential increase. So I'm super excited to introduce everybody. Dr. Diane Duncan, who's my sister from another mister, one of my good friends, colleagues, and honestly, one of the most inspirational female doctors on the planet. So I'm so happy to have Dr. Duncan with us today. And we've got Dr. Abdul Hamid, who is probably just 20 miles from me right now in front of his computer in North Scottsdale. And I have learned so much from Dr. A over the years. And to have someone with such a broad approach, someone that is not just a neurosurgeon, but a neurosurgeon that understands the importance of functional wellness. Again, hallelujah to that, right? And then Dr. Bracek, who brings together not just the knowledge of chiropractic, but brings together the full concept of functional wellness, and is going to talk to us about such amazing data, because BTL as a company is not just committed to great technology. From day one, since I've been working with them, and all of us have been working with them, they bring to you not just technology, but technology backed with science that is peer reviewed and published, full stop. So what we're going to do is we're going to get this ball rolling. We're going to have a really good conversation that goes over some of the new indications and some of our clinical experience and how this differentiates everything. And for me, this is my passion. From day one, when I first got to see EMSCULPT Classic in 2016, the first thing I wanted to do was do something to test its functional capability. We weren't ready, but now we are. And BTL's ready, the world's ready, and I'm excited for us to be able to share some of these new, innovative, not just indications, applications, but things that are truly changing patients' lives. Because guess what? Patients want to look good, but more importantly, patients want to feel good. And you can't have one without the other. So let's get going, because Dr. Duncan, you and I have been on the same page when it comes to this functional wellness, but you've seen the transition from aesthetics to more of a wellness concept. What are your thoughts as a plastic surgeon?
Well, my patients primarily used to come to me for looking good. And as you said, looking good only goes so far. But if you don't feel good and you can't function, then looking good is not really helpful. You and I think, have partially pioneered the U.S. Functional market for BTL. Of course, we've both been to Prague, where BTL is primarily a functional company. And so I did some studies on sarcopenia and functional wellness maybe 3 years ago. You've also published in this. And more my patients are looking at things like longevity, their ability to do things, their ability to stay out of the nursing home and have a health span instead of just a lifespan.
Oh, I love that. I love that. And could you talk just briefly, because your data is so phenomenal, because you're talking primarily about the core-to-floor study, is that correct?
Exactly. So I did two studies. One was a core-to-floor, which we used a single device to measure improvement in core strength. And that number, 33% improvement, over a fairly large span of ages was pretty significant. But in the sarcopenia study, and we'll describe that a little bit more, we did a dual cohort, a young group versus an old group. And surprisingly, the old group showed much more improvement than the younger patients. A third group of the people that were tested were the postpartum young moms who are trying to recover from childbirth, and they also had great benefit.
Oh, that's phenomenal. And this was using biometric measurement, and you looked at things like visceral fat and so many metrics that have gone kind of unnoticed in the past. And here, from an aesthetic perspective, we've got these devices, but we're looking at these amazing metrics that relate to almost every single patient.
Right, and I think once we get towards the end and we're talking about biohacking, we can share with our audience what those biometric measurements are and how can they obtain them if they don't already have them.
You're speaking my language, Dr. Duncan. When you talk about biohacking, remember, biohacking is enhancing your biology through technology. And we're doing that every day with the BTL devices. So this is just looking at the search terms for something like Botox versus wellness. That's a pretty, you can see that upward slope of wellness. And I would argue if you went out from 2020 to today, I think you'd actually see an increase in that slope upward. Would you agree with that, guys? Yeah, I think so.
Definitely.
Yeah.
All of us.
And then, oh, there's a cool one. Wellness versus Ozempic. So you see that big jump up in Ozempic, but then a lot of those Ozempic patients are also looking for wellness at the same time. And they're going to need more help with wellness because of some of the issues that we'll talk about later. But looking at that steady increase, that steady slope, I don't see it. Dr. Duncan, do you see that changing anytime soon?
No, absolutely not. I think the Ozempic and tirzepatide group will be up and down due to both regulatory and experiential differences. You know, people are trying to be on it and off it, but long-term wellness is something that will be forever of value.
Absolutely. So we're looking at, there's so many metrics we can look at because I've seen them as far as relating to what the value of a certain market is. And there's nothing that comes close at this time when it comes to looking at the wellness market. You know, whether it's Botox, whether it's GLP-1s, they're measured in the billions. We got a trillion with the wellness. So clearly it's a massive market, clearly. And we can see that growth there on the aesthetic side. Wow, look at that. Amazing numbers. Most of this is, I believe, US data. But I would imagine that this reflects kind of a global phenomenon. You do a lot of work internationally. Do you see the same wellness trend outside of the United States, Dr. Duncan?
I do, and I think you'll find that the GLP-1s and the tirzepatide is really just getting underway in Europe and Asia. But I think there's no country in the world that is not focused on wellness, longevity, and health span.
So this relates actually to your core-to-floor data because, you know, the statistics of reducing falls, reducing injury. I believe some of this, there's another statistic that's every 11 seconds, someone is admitted to the ER for a fall, for some sort of fracture from a fall. And when we look at the limitations related to age-related muscle loss, that's something that you've had quite a bit of experience with. Can you discuss that a tiny bit?
Well, I think the interesting statistic to me is for patients over the age of 65, a fall with a fracture decreases their lifespan by 50%. That's a pretty big number. And
That's
so
massive. That is massive.
It is. And so if we can reduce the sarcopenia, improve balance, and core-to-floor type of technology, and we'll talk about how you can achieve these results in a bit. But if you can improve balance and if you can improve muscle mass, then we can reduce your mortality by 50% with a fall over the age 65. That's a pretty significant number.
That's remarkable. And it becomes a discussion for just a massive group of patients, potentially. Huge. Okay, so we're going to transition over to some exciting news. Dr. Brasic, are you ready to talk about this indication and how it's relevant to so many patients, and from your experience, what you've seen with the BTL technology?
Yes, and I'd like to say, first of all, with Dr. Duncan talking about that statistic, I mean, it's pretty scary when you look at 2 people over the age of 65 fall, fracture a hip. Perhaps they have a procedure to have that reduced or replacement. 1 out of those 2, Dr. Duncan, you'll agree that 1 out of those 2 will not survive a following year. Within 1 year, 1 of those 2 will die. That's massive. And in the state of Florida, we're looking at over 1 million people a year in this state that are injured and over the age of 65, and 50% of those not making it. It's scary. It's very scary. And so when we look at the search over here and you look at pain, anytime somebody takes a fall or they're having issues with mobility, there's usually some tendinopathy or other joint condition that is restricting them for their normal day-to-day living. And it's the pain factor. And you look at the statistics here, they're huge. The numbers speak for themselves. Look at all the people that have osteoarthritis of their hips, their knees. There's neck pain, back pain. These are huge numbers that are out there affecting our family members, our loved ones, our friends. And it goes without saying that it's made a drastic difference in my clinic. We've been with BTL for 1 year, and we've had a huge change in the way we focus on our care of our patients. It's not just chiropractic now. We're introducing these machines back here and getting phenomenal results.
The interesting thing I wanted to add to that is, do you not find as a chiropractor the concept of being able to build muscle, relax muscle, support the process of what you do with the spine and the musculoskeletal system, it's a beautiful marriage?
Well, of course. And then, I have to applaud Dr. Duncan's research that she did, because that quarter-floor program is what I based my recovery programs for my patients on. With these 2 machines here, first of all, the assessment, as we all know as practitioners, the assessment of your patient is vital. And when you look at the elderly population or those that have been injured, why is it that athletes have surgery immediately after an injury? Because not only are they expensive, but their muscles are in their top physical shape. And if muscles can support the joint or the skeletal system, you want to then realize that you need muscle strength. And the majority of my patients that come in that are elderly, they have no glutes, their quads are wasting away, their hamstrings. These are the largest muscle groups of the body. And with the machines, we've been able to rehabilitate these patients and get them to function. And that's what this webinar is all about. It's the function of the human being. And it's the amazing technology that has changed my practice completely. You look at the stats here, we're talking about over 80% of the patients are going to have pain after surgery. And then you go to diabetic neuropathy, which is blowing my mind right now. It's just tremendous how you're able to work with these devices to make a significant change in people's lives. So when you look at that machine there, that beautiful machine, which is on the picture and behind me over here, it's massive in the amount of energy that it's able to apply to different various areas of the body. And now with these new clinical programs that we have for different joints, we've taken a machine that was once designed for making people look good, and now we're able to help them function better. And the power that this machine is able to put out, and the applications, the various applications, along with BTL's updates that come to us, with great technological backing as far as the clinical research, it just never ceases to amaze me. And we're so excited about what the future of this NEO machine can provide for our patients. It's been fantastic.
What you nailed it, Dr. Brasic, because what you have is this platform where it's almost like now the side effect is that you actually look a little bit better. You've got
Absolutely.
this functional improvement, and at the same time, you get this contouring effect and this improvement in posture and all these other ancillary benefits. And what we're doing is we're taking a great platform and adding more capability to it, whether it's through a simple software update or all the amazing engineers. There's over 600 R&D engineers, BTL worldwide. I used to say 500. The number's grown to 600 plus. So being innovative and being able to add things to an existing platform. So guess what? You have more capability, more use, and more life-changing events for your patients. And we're going to transition over to talking about musculoskeletal health with nobody better than Dr. Abdul Hamid, who has got amazing data to share and wants to talk a little bit about the nuts and bolts of this device that we've been talking about, the EMSCULPT NEO.
Yes, David, absolutely. Well, I'm glad to be part of this, and it's good to see all of you again. But I can tell you this device, the EMSCULPT NEO, is revolutionary. It is one device that truly has bridged the gap between aesthetic and functional. And then when we talk about the functional, there are also the two modalities, which, still the sculpting part with the aesthetic and the fat reduction and muscle building. But then when you get to the wellness aspect of it, and now with the pain talk, is tremendous. What makes it really unique, in my opinion, which I think most of you agree, or all of you actually agree, is that it is the only device that I know of where you're able to combine two different energies in one applicator. So essentially getting 2 for 1. And those two energies, we have the high FEM, the high intensity focus electromagnetic. And that's really where, that magic energy working with muscles. And the beauty about this, what BTL has done, is that through that science, we're able, through manipulating pulses, frequencies, intensities, to actually deliver energy to muscles in the different phases, from injury, acute injury, to spasm, to stiffness, to even optimization performance. And then the RF is an added bonus. It's not just melting fat and eliminating fat, but it's crucial in increasing blood flow, bringing new oxygen, new nutrition to tissues that we need to repair and we need to heal as part of that regenerative healing process. So to be able to combine two energies in one application, and a 30-minute session, it's time efficient, in my opinion. And this device, as of now, there is more than 4 million treatments with the EMSCULPT NEO globally. This is fascinating to know that this number exists. It tells that this machine has changed the lives of so many people across the globe. And again, 45 plus publication for the EMSCULPT and the EMSCULPT NEO. And again, going back to what I started with, it's a device that gives you 2-in-1, bridging aesthetic and wellness together, unheard of. It's truly fascinating. It's truly innovative.
And Dr. Abdul Hamid, the other component, if you want to talk a little bit about, is that RF heating is also gently heating the muscle too. So what are your thoughts about that?
It's heating the muscles. Now here's an interesting thing. The heat is generated even with the muscle contractions. Even when you're doing the high FEM and you're causing muscle contractions, and we're reaching these super maximum muscle contractions, 20,000 contractions in 30 minutes, the contractions themselves are generating heat. And now you have the RF also generating heat. So that synchronization is providing enough heat to bring in blood circulation, and in the sculpting world, or I guess in the sculpting mode, enough heat to melt away the fat, including the visceral fat that is really hard to get rid of.
Excellent. I'm gonna transition a little bit to this concept of more the wellness and aesthetics in that transition to longevity. And what we look at is, we've got this device that has been evolving, and we know that there's multiple applications, but BTL is committed to not just expanding capability, but actually making things repurposed, in that we're able to use the same platform. A lot of manufacturers would put us in a position where we had to buy a whole new box so that we could do something different, like a functional application, where what we have is innovation within the equipment that we have so that we can actually do more with it, go beyond, and have more conversations with our patients. Because what we look at is this broad portfolio, and there's so many opportunities with all these different devices, but at the center, at the core of the kind of the body and functional treatment in the practice, in my practice and most of ours, is EMSCULPT NEO. And we have the ability to cross over to all of these other platforms, all of these other treatments. And now, like, the mindset that I have is when we talk about this biohacking concept, it's really about being able to address the mind, the body, the muscle, the skin, all of that as one big ecosystem. And it's very rare that you have kind of an arsenal of technology that you can actually address all of those different things. So what we're going to look at is this exciting new indication with this device that, you know, when I first saw it, it was more about getting 6-pack or 8-pack abs. And I'll tell you, it's come a long way since then. I'm like more excited about this than almost anything else in the office. Although I do have a bias, we'll talk a little bit about things related to mind and body at some point. So I'm excited about that too, but we're talking about EMSCULPT NEO and its new clearance for pain, and we'll go into some of those details. So if you want to talk a little bit about that, Dr. Abdul Hamid, as far as some of those details, because you were pivotal, and you know you've been at the heart of this investigation.
Oh, absolutely. And when we were saying that bridging the gap between aesthetic and functional, in 2024, we were able to achieve the FDA clearance where we can use now the EMSCULPT NEO to stimulate neuromuscular tissue for the purpose of rehabilitation in the arms and legs. So think about shoulder, elbows, biceps, triceps, elbows, tennis elbow, golfer elbow, wrist, or even the lower extremities from the hip to the ankle, hip issues, knee problems, hamstrings, quads, calf muscles, all the way down to the ankle, and even plantar fasciitis. And now that FDA clearance allowed us now to utilize the EMSCULPT NEO for things like relaxation of muscle spasm, increasing blood circulation, increasing range of motion, prevention of disuse atrophy. And one of my favorite actually indication, which is actually has changed how I practice, is this immediate post-surgical stimulation for recovery. A lot of my patients after spinal procedure, I used to have them wait for few weeks before I can get them engaged into rehabilitation programs. But now, being that this is joint sparing, they're not putting weight, they're laying down, and I can activate muscles that otherwise would undergo atrophy due to lack of use and lack of engagement. That is huge with these indications. So that was in 2024. Now the good news is BTL again. We were able through clinical studies and data to actually now gain another milestone, and that is now the new indications with FDA clearance to stimulate peripheral nerves for the relief of different types of pain, including chronic intractable pain, post-traumatic pain, post-surgical pain, as well as the painful diabetic peripheral neuropathy and the lower extremities. And that is something that we've been waiting for, that we've been asking for. I mean, most of us who've been using the EMSCULPT NEO with the functional mode have noticed patients with back pain, they actually can come back and say that my back pain is better. And it was just a matter of time before we collected the data and observed the results from this research. And now we're able to say, you know what, now it's FDA cleared. So now when you get your device, when you see the platform, we now added in the new updates, there is going to be an added part on the system where you can actually select the back. which something we didn't have before. It was select an extremity or upper or lower. Now,
Yes.
finally, we got to that milestone where we can comfortably say, yes, you can treat the back, you can select the back. There's an actually on the platform, you can actually see it in color, push it, and now you can actually put the applicator and treat the back. And that is huge. That is, as we said, back pain is one of the biggest problem, one of the most common problems that we encounter. Think about patients that have chronic back pain for 3 months or more. And the post-traumatic pain is an interesting one because it's not just after a trauma such as a fall, but also things about the athletes, recreational athletes, or even professional athletes that get injured. To me, that's still a traumatic event, and we're able now to use the technology to help these athletes, recreational or professional, with accelerated recovery and return to play. And then the post-surgical, I touched upon that with my clinic, and definitely diabetic neuropathy, including for me personally, my own mother who deals with that condition. So this is fascinating, in my opinion. It's something we waited for, and now we can say, go ahead. If you have the EMSCULPT NEO, you can do this now.
How amazing is that? That is so phenomenal. Now, Dr. Abdulhamid, can you explain a little bit how the HIFEM, how the functional is different from the sculpting mode as far as the HIFEM delivery?
Absolutely, and it comes down to the ability to manipulate and adjust the pulse, the frequency, and the intensity. So in this setting, we have short pulse duration, lower intensity stimulation, but higher frequency. And all of that is to say, in a simple way, instead of delivering these supramaximum contractions that the sculpting mode was delivering to induce hyperplasia and hypertrophy, we don't want to deliver that in cases where the muscles are weakened, atrophied, or post-injury, where these muscles, after an injury, they go through what I call an inhibition state. They become inhibited, they become stiff because of the guarding phenomena. We're not trying to overpower these muscles. Instead, we're trying to actually provide controlled, fine stimulation, really neuromuscular stimulation that allows these muscles to go through a recovery phase rather than building hyperplasia phase. And by adjusting these parameters, we're able to achieve that. So that's the biggest difference. The sculpting was really supramaximum contraction intended for hyperplasia, hypertrophy. Now this is more of fine controlled contractions that are really gentle to muscular system that are trying to recover from an injury or after a disuse atrophy.
I love that. And Dr. Abdulhamid, I love when you lecture, one of the ways you describe the functional is that it's stretching the muscle, it's relaxing the muscle, it's restoring the muscle. And I think that's just such a brilliant way to kind of summarize it, don't you think?
Exactly, and I'm glad you bring that up, because a lot of time I find providers trying to think of the sculpting as an only aesthetic mode and functional as an only wellness mode. And in reality, both sculpting and wellness are part of, or functional are part of the wellness mode. I'll give you an example. In the acute phase of recovery, I use functional whenever I want to, when the muscles need stretching, recovery, relaxation. But once we get over the recovery phase, we now transition the patient into what I call an optimization phase. And that optimization phase is what I'm trying to actually build muscles, strengthen the muscles. And that's when I will do the sculpting part of it.
I agree with him 100% on that one too. That one works. It's great when you migrate that patient into that higher level.
Yes, and I think that's kind of the journey. You take him from the injury phase to the optimization that afford them muscle strength, increasing muscle mass, and eventually protection. And this is, I guess, what I was talking about earlier, JD, which is now you don't just see an upper extremity or a lower extremity option to pick from, but you can now actually highlight the lower back and use that as one of the added region in the new upgrade.
That's excellent.
And this is excellent. This is something, you know, we didn't have before, and now we have it.
Okay, so we're gonna transition over to talking a little bit about Cortiflor. And when we talk about the different functional aspects, we're going to end up migrating over there. But before that, we're going to have Dr. Brasic discuss looking at his data collection relating to functional improvement with muscles.
Well, you know, in our clinic, we've been doing a lot of functional work with older folks that have tendinopathies and joint pain, that they're unable to exercise as much, and that's what slows them down. You know, the study here looking at, you can see the data here on this slide, which talks about the 36 subjects, a wide range of age group, a wide age group. And then you're looking at 4 HIFEM treatments on the upper and lower extremities. You got your baseline, your 1 month, 3 month follow-up. The beautiful thing, and I think all the doctors will agree, we found phenomenal results that occur long after the last treatment. And it's something that it really doesn't make sense. But my patients are telling me, even after my last treatment, you know, a month after, 2 months after, they're still seeing these improvements. And when you look at the data here, I won't go through all the numbers here. I think we have to continue to move forward. But I think it really comes down to how we're using these machines for the joint patient, the patient that's got the joint pain. And one of the things that we found is that all the joints feel better. When you look at 97% of the people that feel improvement and over 90% were totally satisfied, that's a pretty significant number that you're looking at. Go ahead and jump to the next one, please. And when we look at the lower limbs, see, in my clinic, I have a pain management clinic that sends me some of their worst patients that they really don't want to do surgery on. And we've been juicing our patients up with the EMSCULPT NEO and just having a grand time at this, because we're getting patients better by using the RF along with the HIFEM. You'll find that as you become more accustomed to the machine, and I think the doctors will agree, you'll start getting a sense of how you need to slowly ramp up your heat, how you need to slowly ramp up your intensity of the HIFEM, and you get the patient to tolerate it. And then you'll see that each subsequent visit, they'll be able to tolerate a little bit more, because why? Their muscles are getting stronger. Their joints are able to move better. The tendinopathy is reducing. Would you guys agree with me on that?
Oh yeah, absolutely.
Oh yes, yeah.
It's really working fantastic.
Dr. A, if you could talk a little bit about your study data.
Absolutely. So this study data, which was through the functional mode, again, 34 subjects that we enrolled in the study, and it was 3-to-1 active to sham enrollment. And the protocol was simple in this case. It was 4 30-minute sessions separated by 5 to 10 days. And we collected data, including at the 1 month and 3 month follow-up. And we did muscle testing. We wanted to see, like, you know, the changes in the muscle strength in the lower extremities, as well as, you know, how did our subject react in terms of the satisfaction as well as the comfort level. And the interesting thing from this data is that 3 months at the 3 month follow-up, that is 3 months after the very last treatment session, they did not have any additional treatments with the NEO functional setting, wellness setting. We show 52% increase in muscle strength from baseline, and that is 3 months in the follow-up visit.
Wow.
That is huge, like to see those numbers. And to be honest with you, even this was, you know, part of the study. Obviously, in my clinic, we see that because we continue to implement these testing with all of our patients. And we continue to see that with our patients. And that's an average, meaning there are people that even achieved higher numbers than that. The 52% increase on average from baseline in 3 months with 4 treatment, that is huge in this sort of population. And 83% of the patient documented that the return of muscle engagement, normal movement pattern. And this is the big one that I want to highlight. 83% of these patients suggested or indicated that their muscles felt less prone to injury. That is huge. It gives them that confidence. And again, because I think we focus always on the treatment, but this makes us think about the prevention. Because if you're able to actually increase that, allow patients to feel that their muscles are strong enough, that they feel they're less prone to injury. If we're able to prevent injuries from happening, we're able to maintain function and therefore wellness.
And it marries so nicely with what Dr. Duncan was talking about earlier relating to age-related falls and the different things related to age-related musculoskeletal change. And then what you're happening is this concept of, you're functionally improving the entire core. You're really having improvement that goes beyond just the area you're treating, because you're actually causing a functional change to the entire system, especially the lower body. Really remarkable. And when we look at pain and discomfort reduction, we're going to focus on some of the data relating to that. And we'll have Dr. Bracek take over as far as discussing some of the data that was found in his study.
When you look at the upper and lower extremity, this is a big part of our practice. And this is an area that in Florida is such a huge market for us, because obviously these people are, people come to Florida to spend the rest of their years, and you find that patients are weak. It all comes down to weakness. And why are they weak? Because of that tendinopathy that I mentioned earlier. I think it restricts their motion. And you see them doing like half exercise at the gyms. Whereas with these machines, and there's study information here, but what I like to say is that you'll find that your patients with EMSCULPT NEO, when you start doing this functional work, you're going to be able to see that the patient has better range of motion, because the tendinopathy, the pain and inflammation of the tendons, has reduced so substantially. With Dr. A, when he was talking about, the patients are less prone to injury. That's the big picture here, because what it's doing is it's showing us they're functioning, they're coming back. And as we'll see later in some other slides, some of our patients are finding huge differences with this machine. When we incorporate EMSCULPT NEO, and then we incorporate some just mindful exercises on the patient's part, and as practitioners, our goal, I believe, is to use the tools that we have and our knowledge base and what we're really good at. And when we have technology like the EMSCULPT NEO and the EMSCELLA and all the other BTL devices, we really bring our clinic to a totally different level. And I think all the practitioners will agree. When you look at these systems, it just makes everything work better.
So true, so true. It's about the whole ecosystem, and at the end of the day, when you're able to improve the quality of life in a patient, like how you and the aside to that is you can't really put a price on that too.
Correct.
A lot of these patients, it's really remarkable that we can not only make someone feel better, but we can actually help them prevent an issue down the road, meaning prevention. So I think actually when we talk about wellness, we have to think that it's actually composed of prevention too. I think we actually probably need to spend more time talking about the preventative aspect of everything that we're doing, because in medicine we tend to like to look at a certain endpoint, but let's look at that endpoint, look at what the impact is months and years down the road. Dr. A, I'd like you to talk a little bit about the lower back pain and some of the data that we're going to see here.
Yeah, so the studies that we're just discussing earlier, which is the functional wellness, looking into the strength of the muscle strength in the lower extremities and patient satisfaction and so forth. Now this one was specific for actually the lower back pain. Now lower back pain, in my practice, is the most common reason for neurosurgical evaluation in my office. 83 million days of work lost per year due to back pain. Number 3 reason to visit a doctor in the office. So it is common. Now, this study, we looked at 25 patients between the age of 33 and 76, and we wanted to measure certain parameters before and after treatments including looking at the MRIs of every patient that was enrolled in the study. And those MRIs just to look at the different structural abnormalities, stenosis, facet effusion, fatty infiltration into the multifidus muscles. We also measured the VAS score as a way of determining how bad the pain is. And we had system where it's 0 is none, and then we have mild, moderate, severe. 7 to 10 was considered severe. We also look at our way to assess their wellness or their ability to function. We assessed that through a disability questionnaire, and we did 2 of those just to correlate them. So there was a pain disability questionnaire as well as the Oswestry Disability Index. And again, we tested muscle strength using handheld dynamometer devices. Now, some of the common conditions, and these are the conditions that these patients described, 56% of those patients reported having weakness, muscle weakness in their lower extremities. And that was also verified through the dynamometer testing. And we also used some body composition analysis to look for muscle mass in the lower extremities. 52% reported muscle spasm and tightness. Effusion, facet joint effusion was a big one with 40% of those patients had it. Now, the interesting thing, when we did these studies, on average, the pain score dropped by 76%. Or to give an exact number, on average, the pain score dropped from 6.9 out of 10 to 1.7 out of 10 after these treatments.
That's huge.
That is big. And these patients that were doing this, they actually were patients who already completed courses of PT or chiropractor and had injections, because I'm the last resort. They usually come to me for the surgical consultation. And so that was kind of like unique in seeing that we can actually help this patient even after the fact that they were deemed refractory, right? Now, what's interesting, 100% of the patient whose pain score was 7 and above in the severe category, all of them reported reduction in their pain. So no one post-treatment had pain score above 7 after the end of the treatments. And then disability index, which is an indication of the function, improved by 61% and 66% on both PDQ and ODI. Now, one piece that goes back to the core to floor concept that we started this discussion with, in a subgroup of those patients had actually treatment that included abdomen, lower back, using the EMSCULPT NEO, and then the EMSCELA for the pelvis. And in that subgroup, what we found interesting was that the iliopsoas muscle, which is an important muscle for hip flexion as well as stabilization of the pelvis and the spine, there was 125% increase in that iliopsoas muscles correlating to increased stability of the spine and pelvis, as well as improvement in that hip flexion. Also, which is as very important, is that when we looked at the right and left, there was an asymmetry or imbalance between the two sides, and we were actually able to bridge that gap with 75% reduction in that asymmetry between the two muscle groups, which is important. And that's why a lot of time I encourage, even when there is one side that is healthy and one side that is dysfunctional or have abnormality, we treat both sides to detect that asymmetry and imbalance. And with this technology, or with this core to floor group, we're able to actually reduce it or bring it by 65% average reduction.
Dr. A, I want just briefly, because I want to keep us on time, but how quickly, from a pain reduction, what's your general observation as far as how quickly patients notice a shift in their pain from treatment?
So this protocol was extended over 3 weeks. So we've had patients reporting pain reduction as early as in the first week, but definitely by the 3rd week, these patients reported a reduction in their pain.
That's remarkable. That is really remarkable. And I can say from my own personal experience with functional for pain, I've experienced that kind of experience, so I can echo it. What we are going to, our favorite, pretty much everybody on the panel will agree that when it comes to therapy, combining different therapies together is the way it's at. So we're going to talk a little bit about combining different therapies. And like Dr. Duncan and myself both published papers relating to core to floor. So I always say that my twin is Dr. Duncan, because I work with the postpartum women, and Dr. Duncan has done the same, but she also worked with the elderly group. And we got this massive group of data that is pretty remarkable when it comes to doing core to floor. So Dr. Duncan, can you just talk a little, because we've talked about core to floor, but I think everyone needs to know what that actually is.
So what I usually do for my patients, and I think, the group here might have a little bit of deviation, but most of my patients, when I sign them up, will do 30 minutes of EMSCULPT NEO weekly for 4 sessions or more as needed. And then we'll do 28 minutes of EMSELA, 6 to 7 sessions. And this is 2 times a week. For our patients who need a little bit more of the EMSELA, let's say we have an 80-year-old male who has undergone a prostatectomy, I'll use both programs 1 and 2. So it'll be closer to an hour. But I heard from him today, I treated him 3 weeks ago, and he is down to 1 pad a day instead of 16. That's pretty huge for a person who's always going to the bathroom and totally couldn't do anything else but be close to a bathroom. So that's kind of where we start. And of course, as your patient's needs change, you can adjust.
And you can see the study outcomes here are pretty remarkable. I think you'd agree that the types of changes that we're seeing for patients kind of resonate with that messaging of not being functional, but also kind of being preventative. So if you want to just talk briefly about that and how that relates to treating core to floor.
Well, the thing that I found most interesting about the elderly versus the youthful cohort, balance improved only 11% in the youthful cohort, which were under the age of 35. Those over the age of 60 improved 30.3%. And balance, of course, is something that is very important in preventing falls, which of course we talked about earlier, leading to mortality. I think that the solid satisfaction rate, 93% of all patients treated, speaks to the efficacy, and Dr. A mentioned the durability of results. We did see an improvement between 1 month post-treatment, where no more treatments were performed at 3 months, which is remarkable and tells me that this is a treatment with lasting power.
Absolutely. I always like to mention, one of the things that I had the good fortune of is in the postpartum study, I got to upload all of the before and after photos. And the thing that blew me away was every single one of those photos could have been in a brochure. There wasn't a single one that did not have a reduced lumbar lordosis, improved posture, better abdominal form. And every single patient after week 1 of core to floor noticed some sort of improvement. It was so satisfying and so different from data collection I'd done with other companies where, when they want a before and after, you have to go through like 30 or 40 pictures and you find that one picture, and guess what? That's the picture that ends up in the brochure. But it was like so wonderful to see such amazing change in so many people.
Agreed.
So we're going to migrate to some new data that just recently got published. And this is super exciting because obviously there's that tidal wave of patients that are doing GLP-1s. So what we actually had the good fortune to do is look at how EMSCULPT NEO can improve outcomes relating to GLP-1 use. We know that we have muscle mass decline as we age. This accelerates as you get over 70, meaning over 70, you lose almost 1 to 2% of your muscle every year, where prior to 70, the sarcopenia age-related muscle loss is kind of spread over decades. So there's this acceleration. And then if we add something like a GLP-1 in the picture, it becomes very relevant for a lot of different things. But even core to floor, when you're affecting muscle, if you have muscle loss, which has been shown in multiple studies now to be related to GLP-1 use. In fact, 2 studies show that 40% of the muscle loss from GLP-1s, weight loss, is from muscle loss. That is no bueno. And that affects both men and women. Even just recently, they've been talking about Ozempic vulva. So I've heard of Ozempic face, Ozempic butt. Now there's Ozempic vulva. So who knew, right? But it makes sense. And what we did is we actually looked at data of patients that were taking GLP-1s alone, doing GLP-1s with EMSCULPT NEO, and then we also looked at patients that were doing just EMSCULPT NEO. And the results are remarkable, because what we're seeing is that the patients that are doing GLP-1s alone are losing muscle, and they are losing fat. But the patients that are doing GLP-1s with HiFem, with EMSCULPT NEO, are not only losing fat, but they actually gain muscle. Okay. And when you look at the amount of fat loss in the two groups, there's no significant difference, meaning you lose the same amount of fat statistically on the GLP-1 as you do with the GLP-1 and EMSCULPT NEO. So where that transitions is, I really feel like GLP-1s are like really remarkable. And I do think that there's an element of it that it is like a biohack. It is a way to enhance your biology through technology when it's used correctly. But I think if anybody can interject with kind of this concept of biohacking with EMSCULPT NEO, where we can have this remarkable change of preventing muscle loss while on a GLP-1. We can have these other modalities that can contribute, something like hormone replacement, or we can think of nutrition. But I don't know if anybody has any comments relating to how we can biohack with EMSCULPT NEO. If anybody
I think
has.
a lot of people are really into the peptide thing. And JD, you might expound on this, but I think I would probably first start with the biometric measurements used to track skeletal muscle mass and percent body fat. For me, I tell my patients that if you have twice the skeletal muscle mass as you do percent body fat, this is not pounds of body fat, but percent body fat. So let's say you have 60 pounds of skeletal muscle mass. Your percent body fat is 30, which is a little bit high for women, very high for men. Then, of course, you're at least approaching metabolic health, and your basal metabolic rate will be acceptable. However, I have a lot of patients whose skeletal muscle mass might be in the 40s, and their percent body fat is mid 40s. This is not good. If you can show patients on paper where they are, this is a critical motivator, because a lot of people don't really want to pay for wellness if it's not covered by insurance. But if you show them their biometric data that might not be visible, you're not going to be able to measure your visceral adipose tissue with a ring or a watch yet. Someday we might, but these numbers that really galvanize them to take action. So that aspect of biohacking, I think, is really important and will drive a lot of your EMSCULPT and EMSCELA practice.
And I think a lot of that data, a lot of users are collecting because of wanting that biometric data while we're using the BTL devices, and especially EMSCULPT NEO. And I know Dr. A and I have talked numerous times about the concept of using wearables to track changes that might be happening related to sleep, related to pulse rate, oxygenation, these different things. And there's a lot of different things that could be happening systemically that I think all we want to mention is from a biohacking standpoint is thinking about the interactions of the environment, the body, and what we can be doing aside from technology to work with it. Because the biohack could be something as simple as nutrition. It could be a simple vitamin. It could be a hormone. So thinking about these things and how it can relate to what we do with technology in the office, this is just old school technology that's related to the body. So what we want to do is we want to look at some patient cases. So we're going to share some patient cases and look at some testimonials as well.
Dramatic improvement almost immediately, but definitely steadily over time. Went from significant numbness and even pain down into the top of my thigh, down towards the knee. And if I touched on the inside of my thigh, I would get radiating like I'm being electrocuted. All that's gone now. And I just have a little bit of numbness left at the bottom of the knee. But I think with the machine here that we've been using and the exercises that you've shown me,
Right.
a couple exercises, some stretches, massive improvement. So
That's awesome.
It's exciting. I don't want to get worse.
Right.
So can we stop it? Not only will we stop it, but we've improved it, and which tells me that we can continue to improve it over time, right? So
That's great. So you'd recommend this therapy to others?
absolutely.
Would you say that the Marine Corps would probably endorse it?
It's hard to speak for the Marine Corps, but they and the sports teams I used to play for, I don't know why they wouldn't. Keep people on the field, right?
That's right. Thanks a lot. I appreciate it.
You bet.
You know, that particular patient that was a NFL player for 10 years. And then after that, he joined the Marine Corps and retired as a full colonel. And he was a helicopter pilot, flew every helicopter that the Marine Corps had. And he said that the rotor, that constant pounding, was causing issues. And by using EMSCULPT NEO, and we actually did some EMSCELA on him also, we were able to completely revamp what's going on with his quads and his glutes. So we were using large paddles on that gentleman. In case anybody's curious, how do we take these cases and work them? I do apply the larger paddles to the glutes. I use them sometimes if the patient has a unilateral deficiency. We'll put them on their side, put them in a comfortable position, and put one of the large paddles with the hoses pointing down onto the glute and strap that there into place. And then in his particular case, he actually has a very bad right hip that he was not aware of. And we took some x-rays and found that. But in any event, we were able to strengthen his quad and his glute on the right side to really facilitate this change. And that's a patient that had 4 sessions with NEO. A tremendous, I mean, this is a big guy. He's 6'6" and about 240. And you look at a gentleman like that, you need those big paddles and you need to put in a considerable amount of energy in there. But we were able to use a sculpting protocol to really build muscle in this gentleman. And this came out, we did this before the study that you doctors had released on the functional. But it's amazing to see the results we got with that.
Well, my pain doctor from a sciatica appointments that put me back on my feet recommended you very highly to come in and do some follow-up treatment that would actually strengthen some of the problems that I had. Since I've been here over the past several weeks, I've had several different treatments with several different pieces of equipment that combined have made me feel so much better, so much stronger, and much more motivated so that I could go out and feel like I could walk with some strength, I could walk with some better balance, that, even mentally feeling stronger. I'm in a group of people that are kind of like me now. So everybody wants to stay strong and healthy for as long as possible. This type of treatment is going to give them an opportunity to feel much stronger, much more capable, and much happier, knowing that they have the strength and the endurance that this equipment provides.
Yeah. And the thing is, I don't see this changing anytime soon. This is an example of a combination case using EMSCULPT NEO with low-dose tirzepatide over 30 days. And I can tell you, I couldn't achieve either of those results with isolated of those treatments, but combining those together and having good biometrics using the in-body device, very powerful changes that we can see both for metabolic enhancement with patients. And to me, what it really is about doing things better, doing things better than what the norm is. So that's where addressing muscle, being able to not only strengthen muscle, but to treat muscle functionally. How amazing. Dr. Duncan, can you talk about this case here?
Oh, this is a patient who's been my patient for 20 years. And she had, as you can see, stress incontinence But the big thing is that she had weakness. She had a fall. Her family was very worried about her and took away her car keys and basically moved her bed into the living room and assigned a constant companion to her. She really valued her independence. And I think a lot of our older patients do. They don't want their family telling them what they can and can't do. They don't want to go to a nursing home. So we did a 6-week, basically quarter-floor program, and she got her car keys back. She told her family to go away, changed her front door lock, and now she is outside enjoying life and hanging out with friends and hiking and has a normal life again. And this was within the 6-week period of time. So the ability for our older patients to retrieve their life and basically turn the clock backwards so that their progression to the nursing home or constant supervised living is not inevitable is huge for many of them.
I was in a major car accident back in August of 2024 and had severe pain for almost a year and gained 50 pounds and went through numerous doctor visits. I was referred here from my primary, and this wonderful team guided me, and I had 6 treatments and very skeptical. And let me tell you, I totally believe. I could not go upstairs without having handrails or taking one step at a time. I got stronger and stronger after every visit, and my sleep tenfold better because my pain was better. The numbness and tingling that I was experiencing, 90% gone. So every week when I came, I was excited for the new adventure that I'd be recovering from.
I couldn't tilt my head, be it axially or radially, and now the range I got, nearly the same range I have from side to side. Significant difference going down, where I was probably maybe at 10 degrees when I came in, and just after 5 treatments, I'm able to lay it down as much as I can on either side. So significant improvement. Tried muscle stem.
Yeah.
I've tried automated device that sits on it, a rotary electronic device with heat and rotational on it. Strictly just temporarily, might an hour, almost like a little manual massage is all, nothing long term. But this is just substantially the range that I've been able to acquire over that period of time. Substantial. And that's after doing my neck ablations and my chiropractic care continuously. Couldn't get any result. This is what significantly made the difference.
So what I would say at this point, like hearing those testimonials and having the good fortune to see it in my own patients, and we can all echo this, is the concept that, we can combine these things together and not only improve a patient's life, but we can also, people don't like to talk about this, but we can be successful in business too. It's at the end of the day, we need to pay our bills. So it's really about having the ability to not only have a device that works, that's to deliver both a functional application and broaden the use, but we can combine these things together among a whole suite of devices. We can build packages that can really transform, and it's really simple. My observation, I know Dr. Abdul Hamid is on the same page, is really it's about treating as much muscle as possible. The more muscle we treat, the better the outcome becomes. So whether it's core to floor and expanding the amount of muscle that we treat and respecting whether we're using it functionally or sculpting. And the other thing I get excited about is whenever there is something new, whenever BTL innovates, they have some of the sexiest marketing support in the industry. So I'm excited to see where we go with some of the marketing support that we'll get with some of these new indications. And obviously when there's something new that comes to market, we have to have the post-sale support. because these are all practical things. Because yes, we can have a great device, we can have great protocols. We also need to have the support from the manufacturer so that we can deliver this to our patients. And out of all the companies I've ever worked with, I don't know if anybody has any comment from both the marketing and post-sales support. BTL, has a high bar set. Does anybody have any thoughts about that?
JD, I'd like to mention one thing that you brought up earlier.
Sure.
The concept of having new innovations and updates in your same box.
Yeah.
Because I've had the experience of buying a device and then having 1 year later, this device company decided that they were going to move to a subscription program where you had to buy time on the device, and my old model wasn't going to be supported anymore. So basically all of that money was thrown away. BTL doesn't operate like that. They want your continued satisfaction as a practitioner, and they are very strong about building loyalty. And so we get updates, new uses for the device, upgrades that we've already bought without any additional charge or maybe a nominal fee. And I think, to me, that's just incredible. Customer
Without question,
rare.
it's a differentiator in the market. There's no question. It stands out. And when I do want Dr. Bracek to really briefly, just due to time, to talk about the pain programs. So I keep it really concise. But what I want patients, observers to look at is, we have our standard protocols, which might be 4 treatments, but think outside the box. Again, the more muscle we treat, the better the outcome. So Dr. Bracek, fly through that for us.
So I was looking at some of the questions, and there was a lot of questions about pad placements. And, when you begin with patients that have joint pain, as you can see on the slide there, the small applicators, now that's on a calf. And that was a unique patient there that just had a horrible bilateral calf strain. He went to the gym, did way too much on his first day. He came in and he said, "Hey, let's try it." So, we went ahead and did this. But when you look at your joint protocols, I tend to use the smaller ones until you get to a level where you're increasing the high fem to a level that you're at 100%, and the patient could still take more. Then I'll switch over and do the larger applicators. With the peripheral neuropathy pain treatment protocol, we're doing 4 treatments of the Neo to the calf, and then I'm actually with the smaller applicators like that, and then I'm actually taking the large applicator, putting it face up, so it's facing up, putting the patient's foot right on top of there, and I'm doing 4 treatments with the calf, with the bottom and the sole of the foot. And that's where I get great results. I know we're running out of time, so I don't have more testimonials that we can put on there. Let's go to the lower back. Again, I'm doing 8 treatments, and I'm doing that using the glutes, as I mentioned, and the quad for sciatica. Again, perhaps the hamstring and the glutes, but the glutes are very important. And I think all of the participants or the presenters would agree that the glutes are super important in maintaining muscle strength. And Dr. Abdulhamid was talking about that iliopsoas, and it's a huge game changer how an abdominal applicator can treat those psoas muscles and create strength. So I'll let you continue.
And Dr. A?
Yeah, I mean, I resonate with what has been said already, and exactly what said Dr. McCoy, which is the more muscles that you treat, the better. You can see on the list here, I don't have one muscle that is my favorite. I target abdomen, lower back, glutes, quads, hamstring, calves, different. As a matter of fact, in early treatment, we used to start with EMSCULPT NEO alone. Then we realized adding EMSCELA really revolutionized the outcome. And what recently has been even more fascinating for us is the whole idea of mind and body. And now we're doing these like ExoMind plus EMSCULPT NEO with that mind and body connections. But as a simple rule, if someone has like a sciatica L5S1, I literally just follow the anatomy and where that nerve is going. So we do lower back, glute, hamstrings, and calf. If it's like on higher nerve, like in a femoral distribution, and involves maybe like hip flexors, maybe like lower back, glutes, quads. But in all of them, we're including the EMSCULPT NEO as a standard.
I love it, Dr. A. I mean, those images there, EMSCULPT NEO, Exomind Emsella chair, you can change the world. In my opinion, you can change a patient's world with that combination that you have right there. So brilliant, because it's mind, muscle, body, skin. Oh, I love it. I love it. We've gone a little bit over. I know time is precious. I appreciate every single person out there that took the time to learn from this webinar today. I especially thank all of our esteemed webinar hosts and colleagues that are presenting not just amazing data, life-changing stories, and we welcome questions. I know there were a lot of questions that didn't get answered. We will make sure that you have access to the information. I know that BTL will support that because they want you to be supported. That's why we're doing events like this, and we will do more of them for you because we want nothing more than you to feel good, look good, be educated, elevate your art, and have a very successful business. All of those things are important because we want you to have a sense of purpose in what you do every day, just like we want that for every single patient. Cheers and have a great night. And ask your reps if you have any questions, because they will get you the answers. And if they don't know the answers, they'll connect you to someone like us and we'll get you the answer. And we can talk about those off-label things that they can't. So that's pretty cool. Cheers.
Exactly. So send those questions over.
Absolutely.
Thank you, everybody.
Thank you.
Thanks, everyone.